Good afternoon.
Good afternoon.
Hi, my name is Abbas and I'm a clinician for the afternoon.
Nice to meet you.
Nice to meet you likewise. Can I just confirm your full name and date of birth, please, sir?
My name is Nabil Sondid. I was born on the 1st of the 1st, 2000.
Lovely. And how would you like to be addressed?
Nabil.
Nabil, that means you're
5.
25.
Yeah.
Very nice, very good. Like I said, Zahir, nice to meet you, Sandeep. Nabil, sorry. Nabil, what I've been asked to do by my supervisor is conduct what we call a gait, arms, limb and spine assessment, otherwise known as GALS.
Yeah.
This includes me asking you to do a few movements so as to be able to assess your spine, your arms and your legs. Will that be okay?
Yeah.
There are various components to the test. I will talk you through those as we go along. Okay. Now, in order to do the examination, I will need you to remove your upper garment.
Okay.
The examiner here will act as a chaperone.
Yeah.
And essentially, everything I do here today will remain between you and me, and of course, the medical team that's looking after you, and any other medical personnel, should that be needed. Would that be okay?
Yeah, that's fine.
Wonderful. Are you happy for us to commence?
Yeah.
Great. So, in your own time, when you're ready, what we'll do is do that just before we begin. A few questions, if I may, very quickly.
Yeah.
Do you have any stiffness or discomfort first thing in the morning when you wake up?
Yeah, actually, I got some stiffness in my neck when I first wake up. Yeah.
Okay. How long has that been going on for?
2 months, something like that.
Okay. And was this on the back of any trauma or otherwise?
No trauma,
No trauma. And how long does that stiffness last?
20 minutes, 30 minutes maximum.
And would you say that reduces as you move around?
Yeah, definitely, yeah.
And what do you do for a living?
I'm a student, full-time student.
Okay. Lots of studying then?
Yeah, yeah.
Okay. Any pins and needles, numbness, weakness down the arms?
No.
Any headaches?
No.
Have you had this seen to by anybody yet?
No, I have not.
And have you tried any pain relief for this?
I've taken ibuprofen, and it does help, yeah, just a little bit, yeah.
It does help,
Yeah.
Okay, wonderful. So I suppose what we can do is we can further explore that once we perform the examination. And should there be anything in the examination that needs addressing, I'll obviously can address that as well. Is that okay?
Yeah, that's fine.
Wonderful. So, in your own time, if I might ask you to remove the upper garment, I can see you're in shorts, so I've got good access to your legs. Just the footwear that needs to come off as well. Is that okay?
Yeah, that should be fine.
Thank you. So, to begin with, once Nabil is ready, I'm going to ask the gentleman to start with gait analysis. And here, I'm going to look for various types of gait. Yeah. So, Nabil, in your own time, just going to ask you to walk over to that side, turn around, and then walk back towards me. Is that okay?
Yeah, that's fine.
Here I'm looking for any anti gait, any limping, any wobbling gait, any fenestration or any shuffling, again, of which there is none. Okay, now if I'll ask you to stand over here, facing that way for me, please. So here I'm going to assess general observation on the back. I'm looking for any scars. There is evidence of a scar over here. Now, what was this?
I have a sebaceous cyst that was removed.
Okay, and this was how long ago?
It must be like 2 years now.
Okay, and all clear?
Yeah,
wonderful. Otherwise, aside from that, any muscle atrophy here is what I'm looking for. I'm looking for any lateral curvature of the spine, as well as then looking at the height of the shoulders, the height of the earlobes, any rotation through the cervical spine and below the thoracic rib cage, as well as then moving down to the gluteal folds, gluteal creases, popliteal creases, down to the calf muscles to prevent any atrophy in the muscles, and finishing off at the bottom around the Achilles tendons and the heels, checking for any overpronation that might indicate pes planus. And then going to assess the patient from the side. I'm going to do this from both sides, and here I'm looking at the AP curvature of the spine, cervical lordosis, thoracic-kyphosis and lumbar lordosis. In particular, I'm looking for accentuation of these curves, such as hyperkyphosis, as might be seen in Sherman's disease, or otherwise any obvious abnormalities, such as those found in hemivertebrae. Again, there are no obvious findings or concerns in the given situation. There is very mild evidence for a very mild curvature. Perhaps this is a function of scoliosis, and I will explore that further as we proceed. Okay, Nabil, I'm now going to ask you to do a few movements, if I may, please, sir.
Yeah.
I want you to do these within kind of comfort. If there's any pain or discomfort anywhere, I want you to say, and we'll go from there. Okay.
Yeah.
Lovely. So to begin with, I'm going to come on this side, just for the sake of the camera. As you know, as you were, perfect as that. I'm going to ask you to look down to the floor for me, please, if you will, and up straight ahead again, and up to the ceiling for me, please, and straight ahead again. And now I'm going to ask you to look down to the floor for me, please, and bend forward only as far as comfortable. And come back up again if you will, please. And if I might ask you to do that once more for me, please. And up again if you will, please. Good. I'm now going to ask you to look over this shoulder for me, if you will. And I want you to just place my hand on your waist again.
Yeah.
Twist the body in the same direction. And straight ahead. And look over this shoulder for me, please. And twist the body through, if you will, please. And straight ahead. I'm now going to ask you to bring this ear down to the shoulder. Be careful not to lift the shoulder for me. Once you've done that, I'm going to ask you to slide this hand down the thigh for me, please.
Okay.
In your own time. And up again. And over to this side, if you will, for me, please. So down, shoulder down to the ear, and then all the way down. And up again, if you will, please. So here assessed cervical flexion followed by cervical extension. Moving on then to the lumbar spine, predominantly, but as well as elements of the thoracic. I assessed the distance and the opening of the spinous processes, making sure there was more than 5 centimeters there, kind of Sherber's test. And then I moved then on to rotation in the cervical spine, following into thoracic and lumbar. The patient could have crossed their arms if they wanted, but that wasn't necessarily warranted here. And then I assessed lateral flexion on the cervical spine, followed then into the thoracic and lumbar. The arm down the thigh allowed me to measure how far, made a mental note, how far down the thigh the patient went, and I made a mental note of that on the other side as well to make sure that was equal, which absolutely wasn't the given situation. Thank you, Nabil.
Yeah.
And I'm going to ask you to turn around and face me, if you will, please.
Yeah.
Facing the camera again. That's perfect. So from here, I'm now going to ask you to do a few movements, if I may.
Yeah.
Just to begin with, we're going to start with the jaw.
Yeah.
Just going to get you to relax your mouth and then just move your jaw side to side. That's wonderful. And I'm now going to ask you to bring your hand in the shoulders.
No.
Bring your arms up to your, just put your hand behind, and now pull the elbows right back and relax for me, if you will, please. And both arms behind you like so, if you will. And that's equal distance. That's great. And relax again for me, please. So this is general mobility of the shoulders. Again, no obvious asymmetry or asymmetrical patterns or discomfort or abnormalities. Now I'm going to ask you to bring both hands out in front of you like so.
Okay.
Bend them together and then straighten them all out.
Okay.
That's good. And then bring them here again.
Okay.
I'm going to ask you to just do this with each finger and back as well. Wonderful. Squeeze that and relax. Turn them over. Do that for me, please. Squeeze my fingers, don't let go, and back, and relax.
Yeah.
That's wonderful. I'm now just going to assess your hand, if I may, please. So I'm just going to test for any tenderness over the metacarpophalangeal joints. And there's no obvious Heberman's nose, Bouchard nose, or obvious other deviation of any of the joints. There's also, while I'm here, I can check for any atrophy of the hypothena eminence or thena eminences amongst a whole host of others. While we're here, I'm now going to ask you just to do this one more, please, and then do press down. That's good. Tell me if there's any pins and needles or anything like that, and relax again for me, please, and do the opposite if you will, and do the same again for me. And hold it there, and relax again for me. And again, I would hold this for the best part of 20-30 seconds each. Any issues there?
No.
Great. What I'm now going to do is move on to the final part of the examination, and that's assessing the lower legs. Is that okay? The legs,
Yeah.
sorry, rather. Okay, so if I may ask you to have lay down on your back for me, please, when you're ready.
Yeah.
So again, I'll start with general inspection of the legs. I'm assessing for any trophic changes, any varicosities, any cyanosis, any obvious ulcerations between the toes, and there is no obvious ulcerations. I'm going to check the temperature, and again the temperature is equal bilaterally. There's no obvious deformities or muscle wasting, fasciculations either in any of this. So, Nabil, have you had any hip or knee replacements at all?
No.
Any lower back pain?
No.
Okay. What I'm going to do is I'm going to assess the movement in your ankles followed by your knees and your hips. Okay. So just general movement in the ankle, and again that's absolutely normal, and it's good range of motion, fairly equal. I'm going to take the knee, if I may, holding over it, and this is full flexion of the knee. And then as I extend, I'm feeling for any crepitations. And so same again with the knee. We're going to do full flexion, full extension, no crepitation on the knee. So just going on to the hip from here, just going to take your arms up here from that, please, Nabil. That's good. And now from here, I'm just going to do external rotation of the hip and internal rotation of the hip. And same again, we're going to do external rotation of the hip and internal rotation of the hip. I was watching the patient's face here, looking for any grimacing or any indications of pain, which there was none here. Nabil, I'm just going to slide my hand under your back, okay, the lower back, and relax as best as possible. I'm now going to perform a test called Thomas test. I'm looking for any excessive tightness in one of the knee muscles at the front of your hip, which brings your knee up towards your chest. Is that okay?
Yeah.
Great. Anything too uncomfortable with that, you know, okay. So here I'm going to bring the knee right to the chest, and I'm looking at the opposite leg, the contralateral leg, looking for that to bend or rise, which would indicate tightness in the contralateral psoas. I will do exactly the same thing on the other side as well. So once again, hand under the lumbar spine, I'm checking for that hypertonicity, and I'm also assessing for the lumbar spine to come into my hand. Should that also happen, then there's indications for excessive tightness or hypertonicity in the areas. Just to finish things off, I'm just going to assess for any fluid in around your knees, okay? And so we're going to just do what we call the patellar tap test, and there's no obvious evidence of fluid here. And same thing over here, and press and hold again for to 5 seconds before you then let go, and you look for the rise. Now here that marks the end of the examination. You may now stand and get dressed if you like. Just before we go, actually, tenderness over the feet at all?
No.
Good, wonderful. Thank you very much. That marks the end of the examination. Do you need assistance dressing or anything? Good. I'll sanitize my hands in a moment. I'm just going to hand over while you get dressed to the examiner.
Yes.
Thank you, sir.
Thank you very much.
Any questions at all?
No questions.
So this was a gait, arms, limb and spinal assessment in 25-year-old Nabil, who presented with stiffness in the neck of 2 months standing. This has come in the absence of trauma and is responsive to NSAIDs, although he has not had this assessed. There are no other concerning features associated with the neck pain, including headaches or neurological symptoms. In terms of the GALS assessment itself, this was generally unremarkable for the spine, limbs, both upper and lower. In terms of further assessment, I would consider, in light of the neck symptoms, a specific examination of the neck and the shoulders, given the close proximity, as well as the TMJ. I'll further explore the actual spinal pain, the cervical stiffness, the neck stiffness that Nabil speaks of, so as to better understand the diagnosis there, and I may well conduct any investigations or examinations, including neurological examination of the upper limbs, plus or minus lower limbs, and or cranial nerve examination. Thank you.